We were
Red
up close
marker.
and personal.
I think that's a left marker.
Why is that
Okay.
tape on this versus
Oh, why it has tape on it? The reason why the markers have tape on them is so that you can stick them on there.
I didn't even think about that.
And you end up changing the tape all the time. So we'll start out with finger. And I can do this any way I want to. And sure, I can do it with her. I could have her facing this. And
Like what? Like
yeah, like that. I could do it that way too. Because on the digit, it's really not a big deal on the digit. I prefer to do my digits, hands, and wrists with the arm bent at 90 degrees for the laterals. Although if we're doing digits, it's not a huge deal. Okay, it's not a huge deal.
Wouldn't it do 90 degrees make it easier for them because they can prop the arm up to prevent movement, or no?
Doing it that way is just to keep it the best, the least amount of rotation and whatnot. So, now, of course, I didn't do the whole thing, but you're going to be doing the whole thing. I would have introduced myself. I would have asked her if she was pregnant, if there was any chance she was pregnant. Before I did this, I would have thrown an apron on her lap, the whole thing, okay? This is what you have to go through. You'll be standing at the doorway and you say, "Hello, I'm so-and-so, very glad to meet you. What's your name?" And you say your name and I say, "What's your date of birth?" Or let me, or she's an inpatient, let me look at her medical record number. I gotta go through all that. You're gonna take off any of the jewelry that you have, any of that kind of stuff. And I'm establishing rapport. I talk to you about how was the drive-in and blah, 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 blah. And then I would tell her, I'm gonna do 3 views of your finger. I'm gonna do this one view like this, then I'm gonna do another one a little bit angled, and then I'm gonna do one with the finger on the side. And I happen to be doing the third digit here. Do you remember what the centering point was on it?
PIP.
PIP, yeah. The proximal interphalangeal joint, which would be where, right here? Yeah? Okay. So we did that, and I'm telling you the proper way of doing this, the proper way of doing the oblique is by using a sponge. This is called what we call step sponge or wedge or whatever, but it's at 45 degrees, so if I was doing that, this is the way I would do it. What ends up happening is that I'm able to get this at 45 degrees, and by having each of them on one of these steps, they are spread out enough so that we don't get the superimposition. And again, I center at the at this PIP here, and and I can put my marker in. However, I've collimated down quite a bit. I don't have to collimate down that much. I mean, I could. And that's probably very similar to the one that you were looking at, you, Brittany and Angela, Gina. Sorry, that's her sister's name. So, anyways, this is the best way of doing it. Could you do it at just a 45? Sure, you could. Could you not use a sponge at all and do it this way? That's the way you'll see a lot of people do it. But
is that how you put them, like that?
Yeah. But, and that's about 45 degrees. It's just that the joints won't be opened if you don't use a sponge.
It seems like there'd be a lot of movement risk that way too.
Say what?
It seems like the sponge also helps keep them to where they're not moving your hand.
Right, it does. But really, you just get that support you need. And then when we do a lateral like this, so truthfully on these laterals, if I were doing a hand, and it's probably not a bad idea, what you end up with is that you're better off bending the elbow and
Sorry to interrupt. I need a copy of this or something.
you're short on that one?
Yeah.
Hold on one second. Oh, there's a copy machine right there.
Well, it's funny they called me by my sister's name. There's 8 of us. It happens all the time.
Well, it's better than Hey You, right?
I call my kids the dog's name.
Right.
All 4 of the boys, the dog just gets thrown in.
So I prefer to keep the elbow bent 90 degrees because it gives me a better lateral. I can do my AP, I can do my oblique, but it gives me a better lateral. Now, I'm not worried that much about getting everything into the same plane when all we're doing is a finger. Okay? But when all we're doing is a finger, I'm not worried too much. So, I could go like this, but I'm doing the second one, and I probably am gonna maybe go like this. So, turn your hand over. There you go. And then close the other fingers into your fist. And this is the way that I would do that. Okay, so
When you were talking about taping, is that when you do it? It's hard to do.
well, there's a number of things I could do. I could, who's got a pen on them? I could even do this, couldn't I? I could even tell you to take your hand and push and keep it out like that. I could, okay, to get it as lateral as possible.
This is
Okay.
hard.
It's not easy. It's not easy. So turn it over the other way.
Okay.
We could do it this way.
If you have
And-
someone that's arthritic, would you just do the best you could? I mean,
Yes,
is that?
yes, and this is really, no, don't even put it all the way
No, just
down.
lift it.
That's the way that I would actually, this would be the easiest way possible of doing it.
And it's okay that it's not touching the IR.
No, well, we were gonna get some magnification, but that's the nicest and easiest way to do it. I mean, I can do it this way too and try to fan them out a little bit, but that seems to be the best. Okay? Good. So that's hand. And remember, I had an apron on her, so she was shielded the whole time. We went through all of that. Now to do the hand, put the hand flat down. And I, again, not as bad on this one as far as what happens with the with everything being in the same plane, but I do like it in the same plane. So what I would do is push your stool out, and get your shoulder down. Okay?
Does that reduce movement too?
It reduces movement and it reduces rotation. So this is ideally the way we want it, and okay, so I don't have to be a major stickler about exactly centering, but I wouldn't mind if it was centered, okay? And does that look more or less centered to the IR? At least I don't have it to the side like that, so that when I'm looking at the image, I gotta go like this.
So when you say that you want like an inch
That's what I
on
was
each
gonna
side, Is that where the light is?
That's where the light is.
Okay.
So you need a lot more right here, or?
But here's the other thing.
That's what.
Remember I said this. Well, what is the centering point on this?
MC.
Hmm?
The MC.
The metacarpal phalangeal joint. Yes? Which one?
Middle.
The
Yeah,
third?
The third.
Third.
The third. So that's right here, isn't it? I could feel the head of the metacarpal right there. So I'm on it. But look at what happens. If I'm on it, I clip right there.
Yeah.
So I open up my collimator so that I don't clip, and I'm okay there, but now I have twice as much on this side. That's okay, but that's why I told you, you need to be able to tell me, I center on the third metacarpal phalangeal joint. That's what the book told me to do. But in real life, you heard me saying to Jimmy, sometimes you gotta make a few adjustments. Here's the hand. Okay? If I wanted to be more of a stickler, I could actually straighten out her. So now I've got everything nice and straight.
Is the
Yeah.
marker always going on the right side for all the?
You have to check the book. There's all different things on there, on proper marker placement. It turns out in the end that although the book will tell you it should be here, it should be there, it should be there, it turns out in the end, it just should be on there.
You should put it where it fits.
If they, where it fits, and then also the thing is that people do these without markers. And that's when we have problems. It doesn't seem like you would have major problems, but I have seen it, major problems, major problems. Do you think that anybody ever's gone into the hospital for a knee operation and had them operate on the wrong knee? This happens. Well, the same thing can happen with x-rays. We could actually, and I've told you, I've seen this before, even with organs on the opposite side, and people don't know which way to go. And it's the same thing, you have to have them marked. You have to have them marked, because if you don't, they won't stand up in court, and you don't want to be the one that has to go to court saying, yes, I did the x-ray without marking it, because, you know, that's against our practice standards.
Is that part of your patient intro too, that you verify with them what side you're taking a
Yeah.
picture of?
Well, when you are doing establishing your rapport,
Yeah.
if I were establishing my rapport, this way I say, so what did you come in here with today?
My left wrist hurts.
Okay, your order says your right wrist.
We need to check with the doctor?
Yeah, I think we better. Because I'm gonna also say, well, so what happened to your wrist?
I fell on it when I tripped over my kid's toy.
That's all a part of establishing rapport and getting a patient history.
So if it's wrong, so like how she said it was the left and the order said the right, you have to go back before you can do the x-ray.
Yeah, I
Or they
would,
have to fix it?
this is what I would do, I would say, have a seat in the room, I just have to get that corrected, then I'd call up and I'd say, you guys ordered a left and it was supposed to be a right or whatever,
Mhm.
and then they'd say, oh, sorry about that, well,
Okay.
send the correction. So,
But you have to do what's on the order, so you have to get it changed before
you have to get it
Yeah.
changed, exactly. Yeah, do this. This is the oblique. Yeah, this is the oblique. Well, you don't even have to, that's fine. This is the oblique. Okay, this is how it comes out best. Put your shoulder down. Okay? That's the oblique. That's how it comes out best.
How would you tell someone to do that? You're not just gonna say, put your shoulder down.
Yeah,
Or you will?
yeah. I
They'll
do.
understand what that
I
means.
actually do this. I say, put your shoulder down. We actually need your shoulder in this same plane here. No, that's perfect. Good. Don't move. That's what you do.
Okay.
Because sometimes you tell them to put your shoulder down and people need reinforcement. They just have to do this. Trust me on this. When I have somebody, you can relax. When I have somebody that I'm working here, say at the upright Bucky here, and I'm saying, put your left side against there. That is not what I do. That's not what I do. What I would say here to, if Brittany was my patient, I would say, we need to put your left side against there. Now, I don't want to act like she's a dumb blonde, so what I'd say is your left side, this side is what we're putting right next there, okay? Because whether she's a dumb blonde or she's really smart, she's so nervous while she's in here because she doesn't know what's wrong with her that she can't tell her left from her right. You think that happens?
Oh, yeah.
It happens all the time, that people that they get so stressed that they can't tell the difference between their left and their right. That's why you touch them on that side, to remind them, instead of saying, you know, or if you want to joke, if you don't do that, this always works. When you just say, no, your other left.
Good one.
And you try to lighten it up a bit, because people are so nervous.
Have you ever had a patient get mad at you for
No.
like going over and like touching them, like they took offense to it, like I'm not stupid?
No, I mean, I've probably had a few people over many years. This is what I tell you. A smile and kind words, 99.9% of the time will get a smile and kind words back. And 0.1% of the time it'll get an F you. So,
So with the oblique, with the wedge, that's when the fingers are, you want them open, right?
yeah,
Okay. So does the wedge mess that up because it closes them, or can you
No.
like ask them to like?
no,
Oh, okay. So that's
This is
perfect.
perfect.
Okay.
that's perfect.
So, but we really won't have these, is what you said.
Yes, you will. You will have these sometimes, but not all the time.
But
You might have these also.
what do you
And
do
then if you
without
don't have
it?
So
anything,
just tell them to keep them straight.
then if you don't have anything, all you're doing is going like this.
Oh, okay.
All the tips are touching. The
Yeah. And you can see that. You can see that when you look at the images. You can see it when it's like that.
Is it supposed
And this
to
is the
be
way it's like that.
relaxed, like feeling, or
Yeah, just like
because
that.
I was like all tense.
No, just like that.
So would that be an option for someone that is like severely arthritic and they can't
No, this is
quite
the
line
option.
up here?
This is the option most of the time because you don't have this and you don't have that.
Okay.
What do you do with someone whose fingers are all like that?
That's all I can
You
think
just
of.
go like this. That's all you do, and then you say, that's the best we could do.
Well, and you can see that in the pathology, can't you?
Right,
Yeah.
right. So that's what we do, and it's the best we can do.
Would that be a case where you would probably end up taking more films just to try and get
You
those
might.
more angles?
You
to see
might.
A little bit more?
Well, you might look at your images and then they might say, oh, we really need to see that fifth metacarpal, and we don't see it very good there. Can you kind of twist it a little bit to see if we can?
In that case, it doesn't even really matter. It's like you just want to get the one piece
In
you're
that,
looking
right,
at.
and in that case, it's what do I see, not the position itself. What do I have to do to see what I want to see?
Or we could have angled the.
It's the
Tube
goal, the
and
final
all that.
goal is, yeah, whatever I have to do to see that. Now the lateral. Now, get your shoulder down into, it is important, probably more important on this one than any of the others, that we have the arm in the same plane. And this is what tends to happen on this one. I'm just doing a regular lateral here, and it says that it should enter the second metacarpal phalangeal joint right there. And you can keep the thumb like that. Usually you would do a fan, and we'll do it, and we'll fan it. Yeah, we'll fan. You can fan
Do you
it.
fan it like that or like
No,
this?
you fan it like this, and then and you don't touch them.
Okay.
Okay,
On
so
some of the ones we were looking at, it looked like they were touching.
and they're not supposed to.
Okay.
So we can fan it, okay? But here's the problem with this one. This is the one where we go off lateral more so than on any other, and she's off lateral right there. And so when you think that you have lateral, then push it just a little bit more that way.
And
Okay.
then fan them.
Yeah, and put that there, because this is what has to be, we need superimposition of the ulna and radial styloids right here.
So
Yes.
if we do have a wedge, could we wedge higher to help support that so it's not rotating as much?
Not really on this one.
It is. It's
If
hard
we
to
did it
do.
more towards like the elbow area though, where we're off.
up here?
Yes.
No, we don't really do that. We just kind of bend that back there.
Would it help if, or would it make a difference if you just even did that for the patient, just
No,
so they could
not
feel
really.
something against them?
Not really.
It
You
just
get-
doesn't
You and I
feel.
ran this
It doesn't feel,
It's
it's not
uncomfortable.
it's not a comfortable position.
Well, like with that one, could you put them lower the chair or
Yeah, your table, some tables go down or
raise the
whatever.
table? Or
She's all right the way she is, it's just not the most comfortable. I get it to that point, and this is what I say, please don't move, don't move. But I already set my technique, so I just zip, and I'm not even gonna be on this side of the table. I'm just doing this for you. I'll be there, boom, beep, I'm done, in 2 seconds, and then she can relax. And then when she relaxes, it goes off lateral. That's off lateral, that's lateral, that's off lateral.
So lateral, when it comes to the hand, it's more about the positioning of the wrist versus anything else.
Right, it's superimposition of the
Ulna.
radius and ulna.
Okay.
And you can do it like this, but you're better doing it this way. You're better doing it this way. And now with the wrist here, I would just center her wrist to the IR, and I want to not clench my fist, but I want to pull it back a bit into, and the reason why is pull it back into a little bit like that, and that is to get my wrist closer to the IR. If I have it spread out, it's not as much, but if I have it like this, I've got good contact with my IR, and then I am just centering right on that carpal area there, and I'm good. I'm good doing something like that. And and then on my oblique, I'm just coming up 45 degrees, and that's fine, just like that. It's easy. I don't need a sponge on this one. And then on my lateral, I'm just like that. And I get her down like that. If it's a guy like Eric's size, and you're just doing it, for one thing, let me tell you, you would never be doing finger, hand, and wrist. You would never do that. If you do a hand, you don't do fingers because it's included with it. And if we were doing a wrist on someone like Eric, I wouldn't even give him, you can relax, I wouldn't even give him the chair. I said, just get down here at the end on your knees, or on one
For
knee.
someone that's really tall.
Tall, right. We
That
get a lot of people, right, exactly.
Looks like it'd be more comfortable.
this is more comfortable.
And it's one guy, and it's usually the guy gets down on one knee and does it, who's like 6 foot tall.
Okay, pretend you're proposing.
And that's fine for you, but that doesn't work really good for somebody who's like 60.
That's
Right,
This
that's
is way
it's
more
not so, it's not so
My arm is
comfortable.
starting to hurt.
So relax, so that's it, that's it. I'm just telling you, even like a chest x-ray is so much easier on someone your age.
sure, because they just stand
You
there.
put me,
Sit there.
you put me here, I'm good, I could do anything you want. But once you put my arms up over my head, I'm in pain. I got really bad shoulders. And then if it's a student and they take freaking 10 minutes to get me all set going, what happens is if this left arm stays up for more than about 3 minutes, it starts to shake. And so,
So you're trying to be as fast as you can?
as fast as you can. And I'm not that unhealthy. I mean, I'm a little overweight, but I'm not that unhealthy, but I've got like really bad shoulders, and I can't stay still very long. And if you try to make me, it's gonna cause severe pain, and then I'm not gonna cooperate. Because I'm gonna be like, come on, you know? So that's the positioning. Finger, hand, wrist.
So you're gonna have us do them for you?
All the ones I just did. The only other one that I'd like you to know, in the book you have carpal tunnel.
It's like
Take a look at it at least. You have Stetcher, take a look at it and know it. But is the navicular, and the navicular is just simply that. And that is that we get some ulnar deviation, and what it does is it elongates the scaphoid so it's easier to see. If I had a free moving if I had a free moving tube up here, a ceiling mounted tube, I'd just take that and I'd be like, zip, I'd put a little ankle coming down like this, and it would really elongate the scaphoid. And that's why I say, go ahead and relax. You're learning all the things, but what I want you to know about this is, slowly but surely, you're going to get a feel for what do we have to see. And yes, you have to learn everything by the book. But when you're out there shooting, remember, you could do the scientific method and follow every single step. Or you can do this artistic method where you follow the steps, but you know you got a feel of what you need to see. And eventually when you become a tech, you have a little flexibility on how to do it. And so that's when it's like, who cares how you did it or what you did? We only care about one thing. What's the picture look like?
I have a question.
Mm-hmm.
Me and Brittany were looking at the one that was the person that was injured,
Mm-hmm.
and they did the cross
The
table
cross table.
lateral
Yes.
because they couldn't go like this. So with this machine,
You cannot do
you
it.
can't do it.
Right.
Okay.
They were looking at a hand and wrist that was displaced fracture in a splint. And so when you looked at the arm, it was like this, and here it was like, whoop, came up, because it was like the wrist was dislocated. And so what they did was, they just, you can't do it with this machine.
To do this
but
would have
this-
been
yeah,
really difficult.
they were probably like this. They were probably like that in a splint. And-
Sorry.
Right, we did, this is what happened.
Sorry,
They put
sorry.
this on top of here. They put the IR like this. And then they brought the tube over and they shot this way and it came zip right through to here. So it actually still looks like a lateral, but it's a cross table. We don't worry about that right now, and you don't have to worry about that right now. That's trauma.
We're pretending
we're-
everybody's fine.
Everybody's fine. Everybody's easy and everybody's fine. The finger, hand, and wrist will be one of the easiest things you do. We're starting out real easy. So you practice with this with your partner. Then when you think you're ready, this is what we have. Tomorrow, Jimmy is here from, I think he said 7:30 to 9:30. Maylin is coming in, and she's going to be here from 7 to 3:30, and I'll be here. And so whether you're working on your image analysis or you're working on this, and you can work in here in groups in the lab, but then you can also work in the classroom or whatever, but you're going to get all these positions down. And when you can do this with your partner over and over and over, and you think you got it right, then you're going to come to me and say, I'm ready to comp, or you're going to come to one of the people that I have here and say, I'm ready to comp. And then we're going to like put everybody out of the room except you and your partner, and your partner will be your patient, and you'll do it, and then you'll flip-flop and do it the other way, and it's a pass-fail thing. If you fail, we just say, go back to the drawing board. We don't put it down as a fail, we just don't fill out your sheet. You failed. The only time we fill out your sheet is when you pass.
Okay, so you'll just, we can keep coming and coming in. And
You can keep coming and coming in here and doing it.
Until we get it
But,
right.
but what we'll say is, if you really screwed up bad the first time, we'll say,
Don't ask to
save everybody's time and perfect this before we do
Before you
it.
come back.
Because there will be some fails, but we want more first attempt passes than we want fails.
But we'll be practicing with you and other people, and I mean, you'll let us know when
Right.
you're ready.
Right, absolutely. Absolutely.
Is this something that both your partner and you have to comp at the same time?
Yes.
Or, okay.
It's a team effort.
So when we
do-
comp, we have to do the whole thing from the beginning, like, hi, my name is so-and-so,
Right.
let me wash my hands.
Yes.
Oh, great.
Yeah, it's all role playing, and that's how you do it. And so you and your partner do this together.
Now, we do the introduction for each time for digits, then hand, then wrist, or do we just do it for one and do all the films?
No, you just do it for the one, and then you do all three positions,
Okay.
all three body parts.
For the hand washing, it said in the book, if there's not like a hand washing station visible, that you come in like drying your hands off, like
Right.
you just did it.
Right, that's what I was telling you about tweaking the perception.
Okay.
That's what
So
I
that's
do.
what we would do in this room.
Yeah,
Pretend you have a seat.
Well,
Or
a
just
lot,
come in like drying
most,
your hands
most
off.
radiology rooms have sinks in them.
Okay.
Most of them do. Not all of them, but most of them do. Yes, you're tweaking their perception. That I just washed my hands. It's the same as the pillowcase. I'm gonna change that pillowcase in between every patient, but if
But you
Brittany's
have
my
to see
next
it.
patient, I'm not gonna change it till she actually sees me doing it. Because if I say, oh, Brittany, I just changed it before you came in the room.
Yeah, sure.
You know, so that's, yeah, part of that. And we'll learn this, we'll get this going. You'll see, it's, yeah, I want you to remember, I'll keep on saying it over and over to you about the moment of truth, so that you can curse me on your first day at the hospital. You'll come back and you'll say, damn it, I was going in there to meet the patient for the first time and I kept on going over in my head, moment of truth, moment of truth. That's what I want to do to you, is to make you think about it, because you consciously have to think about talking to the patient. Otherwise, you start focusing on other stuff, and there's uneasy silence. And if there's uneasy silence, that's your fault, that's not the patient's fault. There are some patients that won't shut up, but, you know.
Well, and there's probably some that don't wanna talk to you either.
Yes, and they will say that even.
Oh,
I
okay.
don't really wanna talk, I don't really wanna talk, I just want you to get my x-ray done.
Yeah.
I don't wanna
Should we
talk.
just get it over with?
There will be,
At
yeah.
that point, would you just shut down, be quiet, or would you just make it as, I'm doing this to your hand and make it more like a explain what you're
business.
doing with,
Yeah.
Strictly
know.
business,
so you're still talking, that way
You're
there's
still
no
talking,
silence? Okay,
but maybe not small talk, but strictly business.
okay.
Please turn your hand like this, please bring your shoulder down, thank you, okay, don't move. Beep, all right, next one. Instead of, if I had brought her in and said, oh, how was your day and all of that, and she was like, oh, my kids are crazy and everything, then this is what I would say, oh, I've got kids too. And I would start a conversation like that, if there was some common ground. Or you know, different things, people give me a hard time about my accent now and then. Well, it's a topic of conversation then. Then it's like, where'd you come from? Blah, 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 and all that. So it's something to talk about for 5 minutes while I do the hand x-ray. And likewise, you may have a patient that has a heavy accent or a British accent or something. And you can say, oh, where'd you come from? You know, that type of stuff. So, yeah, whatever, you're trying to make them at ease. And it's something where you learn, and you will, the people who do this the best learn to make a connection immediately. And you might only be with them for 10 or 15 minutes, but they remember you. And that washing the hands and all that, trust me, when they get the survey, the patient survey, and they're asked those questions, you want them to remember you. I can tell you that I used to be the director of radiology in Casa Grande just before I came here, and one thing I did was, all the x-ray techs, I made them business cards. So every x-ray tech had a business card, and on the back of the business card it said, positive or negative, feel free to call the director of the department with your comments regarding your procedure and the technologist who did your procedure. Had this little thing on the back. And so when they finished their exam, they had to give one of their cards to the patient. And I believe they still do that.
I was just, right before you said that, I was about to ask if x-ray techs make business cards
They
for
do.
themselves.
They do. But this we give out, and then they call. Because they remember you. So when they do surveys, they remember you. And that's what you want to be remembered. So yeah, some give out business cards. Yeah, just depends. Call them customer service cards. So now you got a good idea of how to do this? These ones are pretty simple. Centering points for the digit, the PIP, centering hand for the hand, the metacarpal, third metacarpal phalangeal joint. For the wrist, it's mid-carpal area. 45 degrees on the oblique for finger, hand, and wrist. 45-degree oblique. I think we're good. Any questions? All right, have at it. You can practice with each